Hello, my name is Maria Moris, and I am a research fellow from Mayo Clinic Jacksonville. I would like to briefly introduce our study entitled Associations Between Advances in High Resolution Cross Section Imaging Technologies and Increasing Prevalence of Pancreatic Cysts from 2005 to 2014. The real prevalence of pancreatic cysts still remains uncertain. A growing body of evidence suggests that there is an increased trend of incidental pancreatic cysts and that this trend correlates to the technical improvements and widespread use of the imaging diagnostic tests. However, to our knowledge, this has not yet been addressed by any study. Therefore, our study aimed to determine the prevalence of pancreatic cysts in patients undergoing MRI for a non-pancreatic indication and to compare this prevalence with the technical features of the MRIs. To do so, every consecutive abdominal MRI performed in Mayo Clinic Jacksonville during the months of January and February from 2005 to 2014 were listed. Then, the first 50 suitable candidates per year were selected after applying several exclusion criteria, including presence of pancreatitis, pancreatic cysts or masses, a positive history of pancreatic surgery, presence of pancreatic symptoms including abdominal pain, and a pancreas-related MRI indication. Every MRI study was reviewed by an expert pancreatic MRI radiologist who wrote down both the technical features, including hardware platform, software version, and field strength, and the imaging variables regarding the cyst and the pancreas. As results, a total of 500 patients composed the study cohort. Of these, 208 patients, which corresponds to 42% of the study cohort, had an incidental pancreatic cyst. The most common diagnosis was uncertain in 62% of the studies. This was followed by intraductal papillary mucinous neoplasm in 35% of the MRIs. The median cyst size was 4 millimeters, with the majority of patients having cysts of less than 1 centimeter. Only 10% of the patients had cysts comprised between 1 and 2 centimeters, and just 2% of the patients had cysts greater than 2 centimeters. No mutant nodules were seen. Finally, the multivariable analysis showed a strong association between the technical features and the presence of pancreatic cyst. Generally, newer technical features corresponded with higher pancreatic cyst detection rates. Based on our results, almost 0.5% of a non-pancreatic study cohort had an incidental pancreatic cyst. We also demonstrated the association between the higher trend of incidental pancreatic cysts observed in recent years and the technical improvements of the MRIs. There are several implications for our study. Given the very high prevalence of pancreatic cysts found incidentally and the relative low risk of pancreatic cancer in the general population, our results suggest that the true risk of malignant transformation from cyst to cancer is very low. Other previous studies have also reported low incidence rates of malignant transformation in a small asymptomatic pancreatic cyst. Therefore, although pancreatic cystic neoplasm are a very important precursor, much more research is clearly needed to discriminate between which of these very common lesions are at risk of progress and therefore require close surveillance or pancreatic surgery. Thank you.